Such a fracture may not be radiologically detectable soon after injury. The horse should be restrained to box rest or confined to box rest and reassessed radiographically after 7 to 10 days, even if the horse is substantially improved clinically. Consideration could be given to earlier performance of skeletal scintigraphy to rule in or to rule out the possible presence of an incomplete fracture. It is important to recognize that there is the potential risk of catastrophic injury if such a fracture or the potential for such a fracture is not recognized. Bear in mind that the clinical signs associated with a non-displaced fracture may improve quickly, but there is a very real danger of catastrophic injury if the horse is returned to work or allowed uncontrolled turnout prematurely. We also have to consider the possibility of nerve dysfunction as a result of trauma, either a fall, a collision, or a hip injury. So we can see that this pony on the left has instability of the shoulder. The shoulder bulges outwards as the pony bears weight on the limb, with the foot placed relatively axially underneath the trunk. This was the result of a brachial plexus injury. The black horse in the middle collided with a fence during a thunderstorm. This horse also had a brachial plexus injury. The prognosis may be poor. Both of these horses did not show a functional recovery, although they were allowed more than 6 months of time to improve. Whereas the horse on the right, this is 1 day after the onset of the gait dysfunction, similar degree of instability of the shoulder, but this pony showed progressive and rapid improvement within the next several weeks and made a complete functional recovery. The horse on the right has sustained a rupture of fibularis tertius. This horse jumped over the stable door and got stuck on the top of the stable door before it was eventually freed. It shows classical clinical signs of fibularis tertius disruption, so that the hock may be extended while the stifle is flexed. And we see this characteristic concave dimple in the distal caudal aspect of the crus, highlighted by the yellow arrow. And on the left, we see the normal ultrasonographic appearance of fibularis tertius and the complete absence of fibularis tertius in the ultrasonographic image on the right, highlighted by the orange arrows. A horse may sustain acute onset forelimb lameness after landing from a fence, and the most common reasons are a major injury of the accessory ligament of the deep digital flexor tendon, a major injury of a superficial digital flexor tendon, a fetlock region fracture, for example, an incomplete sagittal fissure in the sagittal groove of the proximal phalanx, or cervical or cranial thoracic radiculopathy. So this horse on the right is showing classical root signature posture. The horse landed over a fence, became acutely lame and severely lame, non-weight bearing. Most of these horses, however, do recover very, very rapidly. This horse was walking virtually sound within 15 minutes. However, there is the potential for recurrence.